Hi, I'm Morgan, and this is a public service announcement with some suggestions as to what you could vaccinate some of your market-ready swine for the upcoming season. So, first of all, I wanted to talk about live and killed vaccines. A modified live vaccine is a vaccine that is composed of attenuated microorganisms that create an immune response that is similar to the reaction of the natural infection, but it doesn't typically inhibit the clinical signs of the illness. Whereas a killed or inactivated vaccine is composed of bacteria or viruses that have been killed by exposure to heat or chemical treatment. And these vaccines do not always have the same effect as live vaccines, and inactivated diseases sometimes require repeat doses. So the first vaccine is going to be Lepto-Urvac by Zoetis, and this is just a vaccine to help prevent against leptospirosis. As stated by the Iowa State University, the disease continues to be endemic in areas where environmental conditions are favorable for leptospirosis. However, losses have been reduced by confinement, sanitation, management changes, vaccination, and use of antibiotics. Leptospirosis is now relatively uncommon in modern swine production. This is one of the primary swine vaccines and is administered subcutaneously immediately behind the base of the ear and should be given 2 doses at 4 to 6 week intervals. Another important vaccine to have is the Engelvac PRRS MLV swine vaccination. The one that I'm going to be talking about is by Boehringer Ingelheim, and this vaccine is given to swine to protect against ursyphilis and PRRS, which is porcine reproductive and respiratory syndrome. This vaccine is administered intramuscularly to piglets 3 or more weeks older, and the withdrawal period is 21 days. On the right, you can see a picture of the possible routes of the PPRS virus that's transmitted to swine. Up next, we have the Prosystem TGE/Rota vaccine by Merck, and this protects against transmittable gastroenteritis and porcine rotavirus. This is a modified live vaccine, and it is administered intramuscularly. This vaccination should be given to pregnant sows, and oral administration should be given to gilts at 5 weeks and 3 weeks orally and 1 week intramuscularly, and withdrawal period is 21 days. Up next, we have the Kogelpix vaccination by Cerva, and this is the only vaccine that provides protection against all types of APP. According to the National Hog Farmer, getting an accurate diagnosis is the most important part of APP control. Ruling out actin bacillus ceus and getting an antibiotic sensitivity test complete are both essential. This vaccination is administered intramuscularly, and it has a 21-day withdrawal period. If you look on the right, there is a picture on the left. Letter A is a normal swine lung, and on the right, letter B is a damaged swine lung after having had APP. Thank you guys for watching. If you have any questions, please let me know. Thanks!